Hi, I'm Jennifer.
And Kaylee.
How's it going? I'm Brian.
Okay, so the hot topic that we chose to review was psychotropic medication in children. And the disorder that we decided to relate this to was ADHD. So ADHD, as most of us know, stands for Attention Deficit Hyperactivity Disorder. So Attention Deficit Hyperactivity Disorder, or ADHD, is a disorder that affects the part of the brain that controls attention, concentration, memory, motivation and effort, learning, impulsivity, hyperactivity, organization, and social skills. So ADHD is a neurobehavioral condition with abnormalities in brain chemicals and reduced brain activity. So ADHD is mainly a genetic condition. Genetics plays a huge factor in those who are diagnosed with ADHD, but it also has to do with differences in the brain. So studies have shown that there are differences in how dopamine receptors and norepinephrine works in the brain with those who have ADHD. There are also brain scans have showed reduced activity in the premotor and prefrontal cortex parts of the brain that are mainly in control of attention, concentration, memory, impulsivity, social skills, hyperactivity, those types of things. So there also have been shown to be differences in the volume of white and gray matter in the brains of those who do have ADHD. So hyperactivity is the main difference between ADHD and attention deficit disorder, and that hyperactivity is characterized by that impulsivity. They can't sit still. They're very fidgety. They try to do more than one things at a time. So the impulsivity and the hyperactivity is that main differential between ADHD and ADD. So we'll move on to characteristics, prevalence, and onset. So there are several characteristics of those who do have ADHD. One of the main ones being that hyperactivity and that impulsivity, doing more than one thing at a time, being fidgety. They also have trouble concentrating, trouble staying focused. They don't seem to listen. They have problems planning, organizing, and finishing tasks on time. They may struggle with learning new things. There's a lot of getting in trouble in school for those who have ADHD because they have trouble concentrating. They can't stay focused. They may be in and out of their seats, especially with that hyperactivity and impulsivity. So the prevalence, so 5.4 million children had diagnosed ADHD in 2016, but 5% of adults do have ADHD. So ADHD is not just a childhood diagnosis that they tend to grow out of. Actually, 2/3 of children who are diagnosed of ADHD do not grow out of ADHD and continue into the adulthood and become part of that 5% that do have ADHD. So ADHD is more prevalent in males than it is in females. So 62% of males compared to 38% of females have ADHD. So the age of onset is typically about 6 years old. Severe ADHD is typically diagnosed about 4 years old. Moderate ADHD is typically diagnosed about 6 years old. And mild ADHD is typically diagnosed about 7-year-old. The most common age to have ADHD is between 12 and 17 years old. So treatment options for ADHD. So treatment for ADHD is pretty straightforward for both adults and children. The first line of treatment for ADHD is typically medication. So medications such as Adderall, Vyvanse, Ritalin, Clonidine, and Intuitive are all different types of medication for ADHD. There are stimulants such as Adderall and Ritalin for ADHD, and then there are non-stimulant medications such as Vyvanse and Clonidine for ADHD. ADHD can also be treated pretty effectively with cognitive behavioral therapy with mindfulness as part of that treatment as well. So ADHD can be pretty hard to live with, especially if you are a school-age child, but with medication and cognitive behavioral therapy with that mindfulness, it can be something that is treated.
Okay, so psychotropic medications are used regularly to treat children with ADHD. There are many different views on if children should or should not be taking these medications. Controversies revolve around adverse effects that might impact children, long-term effects that might impact children, and ethical perspectives of weighing the risks and benefits that are associated with ADHD medications. It is important that all parties involved, including the prescriber, the parents, and the child, know the impacts that psychiatric medications can have on them for the child's future. The use of psychotropic medications is often recommended after being diagnosed with ADHD. So, and this is recommended on a case-by-case basis by the practitioner. Medication can be used to support the psychotherapy process, or mindfulness, as Jennifer was talking about. The Maslow's hierarchy of need is used to kind of explain, okay, so if a child is having behaviors from ADHD, it may not be beneficial to go right to therapy without first using medication to target those behaviors first, to get that kind of under control. Because if you don't have symptom relief, then how will the child be able to, display self-growth? Let's see. Okay, so the psychotropic medication in general can be harmful, so it might not always be necessary. There's risks associated with it, such as a higher risk for suicide in youth, and this is a black box warning on the medications that it might increase this risk for youth. It also, there's cost issues with ADHD, so it might be more beneficial to use some different treatments in some situations, such as therapy. And in Canada, there was a study with 250,000 children that reviewed their medical records. And it found that between healthcare visits and emergency department visits, patients with ADHD in general required greater health resources than those without the disorder. So it's good to know where those treatments are effective for cost and for just the benefit of the individual. The most commonly prescribed stimulants or medications for children with ADHD are stimulants. So as Jennifer discussed, those are used to improve concentration and decrease fatigue, and they include like Adderall, Ritalin, Focalin, Strattera, Clonidine, Intuitive. Those a doctor will usually prescribe and explain those risks and benefits. For most children, stimulant medication are found to be a very safe and effective way of treating the ADHD symptoms. So the medication works by helping the child focus their thoughts better and ignore distractions. It helps them pay better attention and control their behaviors. Between medications, there's immediate release, extended release. So often the extended release is recommended so that kids don't have to take a medication during school, and that doesn't interfere with that. According to American Academy of Pediatrics, it may take some time to find the right medication for each child. So it's important for parents to be aware of this so that they understand that it might be a trial and error type of a situation. So it might take a few different medications before you find the right one that works for the child. Some of them might cause some side effects, and so it'll have to be watched regularly through medical checkups by the prescriber. Some of the side effects discussed were appetite, weight loss, sleep problems, and social withdrawal. Side effects, again, should be monitored regularly. One controversy with psychotropic medications on youth is their adverse effects on children. So there was a study done in Canada that found that there may actually be some ways of determining if a child will be negatively affected by adverse effects with medication. This study looked at 99 children from a mental health care facility and then 627 from over a long-term unit over 5 years. So the 99 children that were evaluated at first, they used several different measures: medication checklists, family phone interviews, CAFA scales, assessment and a behavior checklist to determine daily if they were having any effects to the psychotropic medications. It was found that children with a higher number of DSM diagnoses were more likely to have adverse reactions to medications. Also, 2 of the 7 behavioral factors in the assessments predicted several potential adverse reactions from medications. These include impulsiveness and uncooperativeness. So for best practice with youth, it is recommended that we know this so that we can recognize the importance of treating with medication and how it can affect children, and also just to be able to warn families if they're at higher risk of having adverse effects. So another study was done, and this study looked at long-term effects on children with ADHD who use psychotropic medications to control it. So it found that psychotropic medications, it's difficult to do the studies because a lot of them weren't controlled in a way that was systematic, so the results were often non-conclusive. So there was no way of knowing if these kids are really sticking to the medications, and if they are, if they're just outgrowing symptoms or they're just stopping use of medication. So it just wasn't monitored very well. But the study that was done is the MTA study. That was the largest controlled study, which lasted over a 14-month span in the 90s. And this study found that children treated with stimulants showed significant reductions in symptoms, and this was improved even further with behavioral therapy. There is evidence, as discussed, that it may affect a child's growth or their physical development. So a study had found that kids can be up to 1 inch in height shorter and 6 pounds less in weight that are taking medication. But then this was kind of looked at again over a 10-year study, which found no differences, because maybe the kid within the first 2 years lost that weight, but they eventually caught up over time. So there might be some issues there with weight anyways, or the growth for the child, but it's found that it usually catches up with them. Regardless of some of these issues and concerns, lingering on prescribing ADHD medication to children, a really strong statement was made by Dr. Klein. The statement says, parents have to weigh the unknowns of long-term use against the known risks of not treating ADHD in children, a higher risk of school failure, conflict with parents and authorities, and dangerous behaviors. So here the doctor indicates that if children don't get the medication and don't receive the help, they may struggle more later in life due to symptoms of ADHD that interfere with their ability to function throughout the most essential stages of their development. And I'm all set with the psychotropic medications in children.
So it looks like Brian forgot to unmute his microphone for the social work implications.
Now I'm unmuted. Never mind. Good call. All right, so we'll try this again. Social work implications. Clinical social workers need to understand the manifestations of ADHD, as well as the positive and negative effects psychotropic medications have on children. Medication can be useful for mental health illnesses, but not all. For those living with crippling depression or severe mental health conditions such as schizophrenia, medication can be a necessity for stability and safety. The psychotherapy process should always be the first step social workers take for mental illnesses. Medication can support this process by stabilizing a person. Cognitive behavioral therapy, or CBT, combined with targeted medication, tends to lead to significant improvement of attention deficit hyperactivity symptoms. The aim for social workers should be to reduce medication amounts through therapy. Social workers advocate for individuals. Understanding the negative effects of psychotropic medications is an important part of this. Medication can be harmful. Potential side effects include an increase in suicidal thinking and behaviors for adolescents under 24 years of age. It is important for clinicians to be aware of the side effects so they know what to look for in their clients who are taking medications. Dizziness, drowsiness, changes in appetite, sleep disturbance, weight gain, and psychological side effects are potential risks associated with taking psychotropic medication. Medication can interfere with emotions, hindering the psychotherapy process. Many people complain of losing the feelings they used to have or emotional numbing. A concern in the mental health field is many medications being prescribed were developed for adults. The increase in diagnoses of psychiatric conditions in children has led to an increase in the number of children who take psychiatric medications, some of which have only been fully tested in adults. This leaves professionals questioning the long-term effects that psychotropic medications might have on developing children. For the conclusion, in concluding our paper, attention deficit or deficient hyperactivity disorder affects a crucial part of the brain that is responsible for performing everyday tasks. ADHD can interrupt the child's ability to be successful in a social and academic environment. The disorder is caused by genetics, chemical differences, and differences in brain activity structures. ADHD causes a person's brain to function differently. A person with ADHD has trouble paying attention, hyperactivity, concentration, and learning. ADHD can start during childhood and last through adulthood. The disorder is more commonly seen in males, but both males and females can have ADHD. Children are diagnosed at a young age. The average age of diagnosis is 6 years old. Psychotropic medications are used to treat children with ADHD. This is controversial because long-term side effects have not been thoroughly studied. It is important for social workers to thoroughly understand the disorder and the symptoms that occur as a result. Social workers work with clients who have ADHD, and the use of psychotropic medications can be both beneficial to and hinder the psychotherapy process. Psychotropic medications have helped people with ADHD, but the long-term effects are not fully understood, and this causes concern for many. And that's about it. Next are our reference pages.